The year is 1958, and medicine is advancing at a rapid rate. After hard lessons in trauma surgery during the Second World War, the scientific community comes closer to mastering the human body with each passing day. Britain and America lead the charge as the Marshall Plan rebuilds mainland Europe, but the next hero of modern medicine will hail from an unexpected place: South Africa. This is the year that Christiaan Barnard will graduate from the University of Minnesota, becoming a certified practitioner of cardiovascular surgery. Until the mid-20th century, the heart was as untouchable as the brain. But during World War II, for the first time in history, shrapnel was successfully dislodged from the hearts of wounded soldiers. It was risky, but survival rates steadily increased as doctors gained experience. Surgeons in this new field pioneered technologies including medically induced hypothermia and the heart-lung respirator. It could keep patients alive for up to 27 minutes of open heart surgery, and the field rapidly developed with its innovation. But an obstacle still stood in the way of some patients' survival. Certain heart conditions were simply not fixable, even with surgery. In these situations, the patient would be simply considered lost. Christiaan Barnard would come to challenge this seemingly ironclad prognosis. Barnard had a radical idea. If other organs can successfully be transplanted, then why not the heart? He would develop this idea for 14 years, and on December 3rd, 1967, he was the first surgeon to ever perform a successful heart transplant, radically changing the medical world and sparking innumerable achievements and discoveries in the fields of heart medicine and surgery. Barnard broke the barrier of human-to-human heart transplants, and in doing so, marked a watershed moment that would forever alter the course of history. Christiaan Barnard was born on November 8, 1922. Barnard's interest in medicine began when two of his siblings died as babies. His brother Abraham died at age 3 from a heart problem, and his older sister was stillborn. He dedicated himself to making sure others wouldn't have to suffer through the same loss. Christiaan excelled in school and eventually attended the University of Cape Town, where he graduated as a doctor in 1946. Barnard proceeded to intern at Groote Hospital and finally began his career as a doctor in the town of Ceres. After spending a few years in Ceres, Barnard returned to Groote Hospital to study intestinal arteria and developed a medical procedure to cure the disease. Impressed by his work, the University of Minnesota offered him a full scholarship to study medicine. After arriving at the University of Minnesota in 1956, Christiaan Barnard earned his PhD in aortic valve problems and the fabrication of prosthetic valves. Barnard was a brilliant student, earning his PhD in only 2 years rather than the usual 6. He returned to Groote Hospital in 1958, along with a heart-lung machine donated by the American National Health Institute. In the coming years, Barnard would assemble a world-renowned cardiac surgical team and practice the art of heart transplantation on dogs, in preparation for the biggest test of his surgical skills he would ever face. On Saturday, December 2nd, 1967, a mother and daughter walked out of a Cape Town bakery after purchasing a cake. As they crossed the street, a drunk driver blew a red light and struck the pair. Mrs. Derval died instantly in the street alongside her 25-year-old daughter Denise, who was barely hanging on to life. Upon arrival at Groote Hospital, Denise was declared brain dead, but this tragedy would allow for a new life in another: Louis Washkansky. Louis Washkansky was a 54-year-old grocer dying from diabetes and incurable heart disease. By the fall of 1967, Washkansky was close to death and he was suffering. The heart problems had started 7 years earlier with a heart attack. Throughout the next years, he had suffered 3 more. These heart attacks were slowly destroying his heart. Washkansky was barely breathing, but remained positive that his conditions would improve. Then, Christiaan Barnard walked into his life. Barnard offered him the brand new concept of a heart transplant, and he immediately accepted. Minutes into the 3rd of December, a neurosurgeon pronounced Denise Derval dead, who was already draped and prepared for the removal of her heart. Barnard's assistants then swiftly and carefully removed the heart out of her chest. The heart was then wheeled to the adjacent room. For the next 5 hours, Dr. Christiaan Barnard and his team of over 30 surgeons huddled over the patient. Hours of painstaking valve-by-valve connections were made between Darval's heart and Washkansky's circulatory system. After nearly 5 hours and a jolt of electricity, the first heart transplant was a success. With the surgery a success, Louis Washkansky remained in the hospital being pumped full of immunosuppressant drugs that would prevent his body from rejecting the foreign heart. For the days following the operation, Washkansky was healthy, but disaster struck when he became infected with pneumonia. The doctors believed that his body was rejecting the heart, so they increased the amount of immunosuppressant drugs. This was a fatal decision, causing the pneumonia to spread to the other lung. Sadly, 18 days after the transplant, Louis Washkansky died of bilateral pneumonia. But the fact stood, the heart itself did not betray him. The surgery was still a success. When Denise Darval's heart was shocked into action inside the body of Louis Washkansky, history was made. Over the next 3 days, almost the entire world had heard about Christiaan Barnard and his victory over the human body. Reporters flooded into Cape Town to interview and take pictures of the world-renowned heart surgeon. Immediately, the first heart transplant became one of the most publicized events in medical history. The world went crazy with even the littlest details, such as what Louis Washkansky had for breakfast the day after his surgery: a hard-boiled egg. Barnard embraced his newfound fame, traveling around the world to talk about his success. In the coming years, Barnard's groundbreaking surgery led to massive discoveries and improvements in healthcare. South Africa's surgeon redefined the definition of brain death for the entire world. He also prompted South Africa to pass laws regarding organ transplantation. A new drug named cyclosporin was discovered and is still used today in heart, liver, and kidney transplants. The drug increased the success rate of these transplants, enabling many people suffering from an incurable disease to live many more healthy years.
I was born with muscular dystrophy, and that's a disease that affects your muscles, and it started to affect my heart muscle. My heart was in bad shape. I probably had less than a year to live.
Heart transplants are still saving people's lives to this day. Over 5,000 transplants occur each year worldwide, 2,000 of which are in the United States. There is an 85 to 90% success rate, meaning that the patient survives for at least 1 year, or in most cases, much more.
When I was transplanted, before I was transplanted, talking to the doctors about what my prognosis would be post-transplant, he said, well, Ned, he goes, you probably gave about a year of your life now to go through this process, the operation, the recovery, all that, and I probably bought you another 10. So I've had 22. So I can't complain about my quality of life. I mean, I'm still here. I never expected that.
Medical history was made with the first heart transplant surgery. Christiaan Barnard brought the world one step closer to mastering the human body when Louis Washkansky survived for 18 days with Denise Darval's heart beating inside his chest. Barnard broke the barrier of human survival, extending Louis Washkansky's life for 18 days when no one thought it possible.
It's created a whole field of medicine around the heart transplants. So it's not only the heart transplant, but the before care, the after care. There's a whole group of nurses that are dedicated to that level of care, and the supplementary people as far as the medications that they need so that they don't reject their drugs. That's all been part of heart transplants that has grown since that surgery was performed.
The first heart transplant spurred medical advancements beyond Christiaan Barnard's imagination into the world we live today, where endeavors such as stem cell regeneration and limb replacement are commonplace, where everyone has been given a glimmer of hope when their own bodies seem to fail. Christiaan Barnard and the first successful heart transplant in 1967 provided this hope and the very platform on which the medical world stands today.